Good day everyone, I am Mabel Galosa from BSP 3B and today I will continue the discussion about the mood disorder and suicide. So for my part, I will be discussing the treatment of mood disorder and all about suicide. So before anything else, mag-recall muna tayo tungkol sa diniscuss ni Yasmin Solano and ni Victor Wafa. So first, moods. So alam natin that moods are feeling states that color our psychological lives. So marami sa atin is nakaka-experience ng changes sa moods. We felt elated when we have earned high grades, have a promotion, nakakakuha tayo ng affection from our kinilalang Mr. or Mrs. Right, and nakaka-feel naman tayo ng down or depressed when we are rejected by a date, nag-flunk sa test, or nagsasuffer ng financial reverses. So, alam natin na it is normal and appropriate to feel or to be happy about uplifting events. And normal lang din na maka-feel tayo ng depression or maka-feel ng depressed by dismal events. Pero it might be very abnormal if we did not feel down or depressed in the face of a tragic or deeply disappointing events or other circumstances. So, but people with mood disorders experience disturbance in the mood that are unusually severe or prolonged and impair their ability to function in meeting their normal responsibilities. So, some people become severely depressed even when things appear to be going well or when they encounter mildly upsetting events that others take in strides. So, most of us have periods of sadness from time to time. Nakaka-feel tayo ng down in dumps, cry, loosen interest in things, have trouble concentrating, nag-expect tayo ng mga worst things to happen, and even minsan, nagko-consider tayo ng suicide kapag nakaka-feel tayo ng periods of sadness. So, for most of us, mood changes pass quickly or are not severe enough to interfere with our lifestyle or our ability to function. So, among people with mood disorders, including depressive disorders and bipolar disorders, mood changes are more severe or prolonged and affect daily functioning. So, meron tayo ditong types of mood disorders. We have the depressive disorder. Ito na yung tinatawag nilang unipolar disorder. So, under this, we have the persistent depressive disorder or yung merong chronic pattern of depression. And also the premenstrual dysphoric disorder. Ito na yung marked changes in the mood during a woman's premenstrual period. So, another type of mood disorder is this bipolar. Ito na yung mood swings disorder. So, nag-involve ito ang states of both depression and elation which appear in an alternating pattern. So, papalit-palit yung state ng depression and elation dito sa part na to. So, in this table, makikita natin ang different common features ng depression. Dito, makikita yung changes in emotional states, changes in motivation, changes in functioning and motor behavior, and also the cognitive changes. So, meron din dito ang cognitive triad of depression. Ito na yung negative view of oneself, negative view of the environment, and the negative view of the future. So, another table, it is about automatic thoughts associated with depression and anxiety. So, ang mga thoughts na associated sa depression, example na lang is yung, I am worthless, I am social failure, ito na yun. Life isn't worth living. Yan na yung mga associated thoughts with depression. Kapag naman sa anxiety, ito na yung parang mga negative na mga mangyayari. Like, I might be trapped, or I'm losing my mind, or I am going to injured, mga ganon, mga negative na naiisip natin. So, proceed tayo dito sa treatment of mood disorder. So, okay, let's go to treating depression. So, depressive disorder are typically treated with a psychotherapy in the form of psychodynamic therapy, behavior therapy, cognitive therapy, or with biomedical treatment such as antidepressant medication or the electroconclusive therapy or ECT. Sometimes, a combination of treatment approaches works best. First, we have the psychodynamic treatment. So this is a traditional psychoanalysis aims to help depressed people understand underlying ambivalent or conflicting feelings toward important people, objects in their lives whom they have lost or whose loss was threatened. So one form of psychodynamic treatment is this interpersonal psychotherapy or IPT. So this is a relatively brief therapy that usually lasting no more than 9 to 12 months that emphasizes the role of the interpersonal issues in depression and helps clients to make healthy changes in their relationships. So this interpersonal psychotherapy or IPT is usually brief. This is a psychodynamically oriented therapy na nakafocus sa mga issue ng person's current interpersonal relationship. So kagaya ng traditional na psychodynamic approaches, this IPT assumes that early life experiences are the key issues in adjustments. But IPT focuses on the present, yung sa ngayon na mga issues and problems. So the next one, we have this behavior therapy. So behavior therapists generally focus on helping depressed patients develop more effective social or interpersonal skills and increasing their participation in pleasurable or rewarding activities. So the most widely used behavioral treatment model called behavioral activation. So it encourages patients to increase their frequency of rewarding or enjoyable activities. So the term behavioral therapy. So this is kind of therapy that used interchangeably. So ito yung kind ng therapy that tries to find and help people change their unhealthy or self-destructive behavior. So it is based on the idea that all behaviors can be changed and pwedeng matutunan yon. Okay, dito tayo sa cognitive behavioral therapy. So, ang mga therapists dito is naniniwala that distorted thinking or yung cognitive distortion plays a key role in the development of depression. So, dito, yung mga taong depressed is mas nakafocus on how they are feeling than doon sa thoughts kung bakit nila nararamdaman yung feeling na yon. So, for example, sabihin natin na napakalungkot ko, iisipin ko na napakalungkot, yun talagang iisipin ko yung napakalungkot ako, pero parang isinasawalang bahala ko yung dahilan kung bakit ako malungkot. So dito na papasok yung cognitive therapist. So itong table na to nagpapakita ng some examples ng distorted, then yung mga automatic thoughts, the types of cognitive distortion na nire-represent nila, and yung rational or alternative responses na pwedeng gamitin pamalit dun sa distortions na yun. So for example lang, itong automatic thought, meron tayong automatic thought na I am alone in the world. And then, ang kind of cognitive distortion niya is yung all or nothing thinking. And then, pwede tayong magkaroon ng rational response na it may feel like I'm alone, but there are some people who care about me. So, ganun siya. So, ang cognitive behavioral therapy is relatively brief. Naglalast ito siya ng 14 to 16 weekly sessions. So, ang therapist dito is gumagamit ng combination ng behavioral and cognitive techniques para matulungan yung mga clients na ma-identify and ma-change yung dysfunctional thoughts nila at saka ma-develop ng more adaptive behaviors nila. One of the example ng cognitive therapy for depression is yung conversation ng client and ng therapist. Okay, let's proceed to the biomedical treatment. So this is the most common biomedical approaches to treating mood disorders are use of antidepressant drugs and electroconvulsive therapy for depression and lithium carbonate for bipolar disorder. So dito tayo sa antidepressant drugs. Antidepressants increases the availability of certain neurotransmitters in the brain, but they do so in different ways. Ayan, meron tayong 4 major classes of antidepressant drugs. First, we have the tricyclics, the monoamine oxidase inhibitors, the selective serotonin reuptake inhibitors, and the serotonin norepinephrine reuptake inhibitors. Okay, the tricyclic, which include the trophanil, the Elavil, the norphamine, and the Cinequan are also named because of their 3-ringed molecular structure. So, ito sila is nag-increase ng brain levels of the neurotransmitters, norepinephrine and the serotonin by interfering with the process of the reuptake of these chemical messengers. So next one is the MAO inhibitors. They increases the availability of neurotransmitters by inhibiting the actions of the monoamine oxidase, an enzyme that normally breaks down or degrades neurotransmitters in the synapse. So the MAO inhibitors are less widely used than other antidepressants because of potentially serious interaction with certain foods and the alcoholic beverages. Yung SSRIs naman, such as fluoxetine or the Prozac, the sertraline or the Zoloft, work in similar fashion as the TCAS by interfering with reuptake of neurotransmitters, but they have some more specific effects on serotonin. Okay, and the SNRI, such as the venlafaxine or the Eferox, they selectively target reuptake of both norepinephrine and the serotonin, which increases level of these neurotransmitters in the brain. So it is unclear whether this dual targeting action produce any clinically meaningful improvement in treatment responses over other antidepressants. So regarding this, investigators understand how depressant affects the neurotransmitters levels, but as noted earlier, the underlying mechanism explaining of how they work to relieve depression remains unclear. So these are the most common prescribed antidepressant drugs, classes, drugs names, dosage, and the side effects. Andyan na. So another treatment of depression is the electroconvulsive therapy and transcranial magnetic stimulation. So this ECT or the electroconvulsive therapy, mas commonly kilala siya as shock therapy. So continues to evoke controversy. So ang idea nito is passing an electric current through someone's brain may seem barbaric, yet evidence supports ECT as a generally safe and effective treatment for severe depression and shows it can help relieve major depression. So in line with this, dito ang electrical current of between 70 and 130 volts is applied to the head to induce a convulsion that is similar to a grand mal epileptic seizures. So ECT is usually administered in the series of 6 to 12 treatments given 3 times per week over several weeks. So the patient is put to sleep with brief acting general anesthetic and given a muscle relaxant to avoid wild convulsions that might result in injury. And proceed tayo dito sa treating bipolar disorder. So bipolar disorder is most commonly treated with drugs that aim to stabilize mood swings. Okay, so sabi daw that the ancient Greeks and Romans were among the first to use lithium as a form of chemotherapy. So they prescribed mineral water that contained lithium for people with turbulent mood swings. So today, the drug lithium carbonate, it is a powdered form of metallic element lithium and is widely used in treating bipolar disorder. So this lithium is nakakatulong para ma-reduce yung mania and ma-stabilize yung mood ng mga bipolar patients. So although lithium is still widely used, may limitation pa rin sa paggamit ng drugs nito and naghahanap pa rin ng alternative treatment. So anticonvulsant drugs use this kind of treatment para ma-reduce yung manic symptoms and ma-stabilize yung mood ng mga people na merong bipolar disorder. So, isa sa ways para ma-treat ang bipolar disorder is through psychological treatments, gaya ng binanggit kanina. Kailangan dito ng cognitive behavioral therapy, yung interpersonal therapy. Pwede rin siyang gamitin ng family therapy that might be helpful when used along with drug therapy in the treatment of bipolar disorder. So, ayun. So, ayan, to summarize the treatment in mood disorder, isa sa mga pwedeng maging treatment is psychodynamic treatment like the interpersonal psychotherapy or IPT, the behavioral therapy, the cognitive behavioral therapy, the biomedical treatments like antidepressant drugs, the electroconvulsive therapy, and the transcranial magnetic stimulation. So, to treat bipolar disorder, ginagamitan natin ng lithium and other mood stabilizer, and also ginagamit din natin ng ibang psychological treatments.